Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question has to deal with recovery from narcissistic personality disorder. Now, in my career, I've treated a number of people with NPD, and of course I've read a lot about cluster B personality disorders and all the personality disorders. And this question is really asking, what's that recovery like, but also what are some of the challenges we see early when recovery starts to occur? So early in recovery, what are some of the obstacles that might come up? This is something that you won't really find a lot about in the research literature. There's not a lot of studies directly on the recovery process from NPD. Now, of course, I've worked a lot with individuals who have cluster B personality disorders, including NPD, and I've made some observations over the years, just things I've seen with recovery from the disorder. So first, I think it's important to note here that many individuals, even clinicians sometimes, who have experience working with disorder, don't believe that individuals with NPD have a very high probability of making a recovery. It is a treatment-resistant disorder. I can understand the pessimism when it comes to kind of the question, do people with the disorder really have a good chance of recovering? Yes, there are some challenges, but recovery can certainly happen. I've seen it. It's not particularly common. It's not the expected result, unfortunately. But when somebody develops insight and they start to see their behaviors and they reach out for help, recovery is certainly possible. And again, I've seen it happen, and I've seen some fairly amazing results, at least in my opinion. So, narcissistic personality disorder, of course, as I mentioned, is a cluster B personality disorder. It's in the same cluster as antisocial, borderline, and histrionic personality disorders. And it has a number of symptoms associated with it. I won't go over all of them here, but we see a sense of entitlement, needing admiration, manipulating others, being jealous, and a grandiose sense of self-importance. So a lot of different characteristics that could damage, and oftentimes do damage, relationships and hurt prospects in terms of career, although sometimes it works the other way and the careers actually go pretty well. So NPD is a little unusual in that way. But most of the time we think of it as destructive and harmful across a number of domains. Now, a personality disorder is different than a mental disorder. It's not a personality disorder in a few ways. But one of the elements that stands out a lot to me with NPD, as well as the other personality disorders, is it's not a set of symptoms in addition to somebody's personality, right? So if we look at a disorder like generalized anxiety disorder or major depressive disorder or post-traumatic stress disorder, an individual has a certain personality, let's say a certain profile on the 5-factor model. So we remember this by the acronym OCEAN, openness to experience, conscientiousness, extroversion, agreeableness, and neuroticism. So they have this profile, and then we see symptoms added to it. Now, you could argue that neuroticism plays a part in both anxiety and depression. And sure, the neuroticism trait does move. We do see changes when somebody has depressive symptoms or they're anxious, and somebody with those disorders would be more likely to be higher in neuroticism. But we wouldn't necessarily see a lot of changes or expect a lot of differences with the other traits. So somebody has a personality profile, then they have these symptoms, and the symptoms are kind of added on. So that personality is there, and then we see these other symptoms that can get in the way of functioning, but they're not really an alteration or extreme deviations in personality traits. Now, personality disorders, of course, including NPD, are extreme manifestations of personality traits. So, in a sense, if we think of a person in terms of their personality, the personality disorder kind of takes over to some degree. That's how a person relates to the world. And the personality disorder characteristics that we see with NPD usually start early. NPD can develop quite young, and of course it's expected to stay around a long time, potentially the entire lifetime. So here's the problem. Say that somebody has NPD for 30 years. Let's say they were first diagnosed or diagnosable at age 15, and they come in at 45 for treatment. So they have 30 years of not building a pro-social personality. 30 years of not empathizing, 30 years of having a sense of entitlement, envy, needing admiration, manipulating other people, having fantasies of power and success. So they've been, in a sense, rowing the boat in the wrong direction. They've been building a personality that's not highly compatible with good relationships. It's not highly compatible with society. And they've been neglecting to build the personality that would have been helpful. So it's more than just stripping away the narcissistic symptoms. Because if you could strip away those symptoms, what would you have left? The pro-social personality never had a chance to develop. So it's not like removing something that's not helpful and expecting to see something helpful underneath of that. That's how we would conceptualize something like depression or anxiety, like I talked about before. If you could remove the depression, if you could remove the anxiety, you would get to that person's personality without those symptoms. And in general, of course, we'd expect that personality to be somewhere toward the middle of the bell curve. It would be a relatively normal personality. You'd want to get to that personality. You'd be stripping away the negative and those characteristics that interfere with functioning, and you'd have a personality there that would be somewhat pro-social, at least. With narcissistic personality disorder, when you strip away those characteristics, you don't know what you'll find. Probably, a lot of times anyway, in my experience, a very undeveloped and immature personality. One that, again, never had the chance to fully express as pro-social. So with personality disorders, it's not only getting rid of the symptoms, it's adding essentially personality traits. And there's not really a protocol for that. Counselors aren't personality builders. We can help people to clarify their values, to be productive, to function, to get along with other people. And I guess if we do that enough, that starts to construct some facets of a personality. But that's really the challenge I see with NPD. It's not necessarily getting rid of the symptoms. It's what to do after that. Although, of course, the symptoms are treatment resistant a lot of the time. So there are challenges here in two directions. That's really the difference I see with personality disorders in general. Now, specifically with NPD, what are some of the obstacles other than that? Well, we'd see that when somebody becomes aware, because in order to recover from NPD, insight does have to increase. They would first look at all their behavior and maybe be skeptical that their behavior wasn't useful, but over time, they'd start to realize that in all these different relationships, and all these situations where there was strife, where there was anger and conflict, a lot of times they were responsible. So there's a sense of embarrassment. There's also a period of time, of course, where some of the symptoms are mitigated, but some of them aren't. So you see some kind of ebb and flow, some cyclic behavior. So they might be less narcissistic in 1 week, and a little bit more so the next week, but the general trend, you would hope, would be leaning toward less narcissism. So we see that embarrassment, we see shame as they start to own those behaviors and realize kind of how the narcissism was influencing them, how it really did represent their personality, and how other people see them, which again usually isn't in a positive way. So what I've really seen in my experience, specifically treating NPD, is that when narcissism is stripped away, you're left with some avoidant personality disorder symptoms, avoidant personality features. Maybe not enough to meet the full criteria of the disorder necessarily, but just certain features. A withdrawal. Narcissism, especially the way it's defined with NPD, is an assertive disorder. Grandiose narcissism has somebody being active and assertive. Avoidant is, well, avoiding, retreating, withdrawing, pulling into oneself, being more introverted, and, of course, feeling shameful and embarrassed. So, in a sense, that's what is left over a lot of times. When the narcissism, that protective mechanism, that mechanism that protects a fragile sense of self is gone, avoidance is what's oftentimes substituted. Again, not every time. It really depends on the presentation of NPD, but I've certainly seen a theme where avoidant personality features do tend to emerge as we see a withdrawal of the narcissistic symptoms. So it's really an interesting dynamic there between a cluster B personality disorder, narcissistic personality disorder, and a cluster C personality disorder, avoidant. We normally wouldn't think there'd be a strong connection between grandiose narcissism and avoidant, but again, a lot of times when somebody has grandiose narcissism, they also have vulnerable characteristics. We conceptualize the disorder oftentimes as moving back and forth between grandiose and vulnerable. So this would leave us thinking that it shouldn't be surprising that we would see an overlap with borderline personality disorder, because that has some similarity with vulnerable narcissism, but also some overlap with avoidant personality disorder. Avoidant personality disorder could still be conceptualized as protecting a fragile sense of self. So anyway, these are just some thoughts I had about narcissistic personality disorder from my experience treating the disorder and what I've seen. There could be a number of obstacles. For some people, you might not see those obstacles. I would be interested in seeing your comments if you have thoughts about NPD and the recovery from NPD and what you've observed or what you think might be happening there. As I said, it's certainly an interesting dynamic, recovery from a disorder where there oftentimes is not recovery. So again, we have kind of a small sample size to work with because we don't see a lot of recovery around that disorder, unfortunately. So again, if you would leave comments, I'd certainly appreciate it. I think it would be an interesting dialogue talking about NPD and recovery and what might happen there. I hope you found this description of narcissistic personality disorder recovery to be interesting. Thanks for watching.